Hello, I'm Emily. I'm a respiratory therapist, and today I have a case study for us. I have a 50-year-old female who has come into the emergency department with shortness of breath, hemoptysis, which is coughing up blood, and a productive cough. The history of present illness: the location of the blood seems to be coming from the lungs. The quality is that the coughing of the blood has not gotten better. The severity is the patient has been coughing up about 2 mLs of fresh red blood. The duration has been happening for 1 month. The timing seems to happen mostly in the morning when the patient wakes up from bed, and the patient has been taking cough suppressants to help relieve the cough and stop the bleeding. The past medical history is the patient is a 20-year pack history smoker. She has been smoking 1 pack of cigarettes per day for 20 years. The presentation is the patient has come into the emergency department with a productive cough, coughing up blood into a napkin. The patient's productive cough sounds like a smoker's cough, and the patient smells of nicotine. The medication management, the respiratory therapist is going to provide PAP therapy, which is positive airway pressure therapy. We're going to do that Q4, so every 4 hours, to try to help open up her lungs to see if that helps with her shortness of breath. We are also going to do incentive spirometry multiple times per day, and we are going to try bronchodilators to see if that helps with her shortness of breath. The plan of treatment is we are going to do a sputum sample. We're going to check the white blood cells in the sputum to see if it could possibly be pneumonia. We are going to do a CT scan and see if the patient has a nodule in her lungs. If the patient does have a nodule, we're going to go ahead and do a bronchoscopy and take a sample of that nodule. And if they have lung cancer, we're going to go ahead and start chemotherapy and radiation. So we went ahead and diagnosed her with lung cancer based off of the presentation, and the sputum sample did not show large amounts of white blood cells. So since we have done that, we are going to go ahead and provide chemotherapy and radiation since she does have lung cancer. We are also going to provide education to the patient and family. We're going to provide education to the patient because chemotherapy can cause nausea. It can also cause the patient to be tired, too tired that they may even have to stop working if they are working. We are also going to provide education to the patient because if they're going to continue smoking, they need to know that smoking is the #1 cause of lung cancer, and we are finding that secondhand smoke is also causing lung cancer. We're also going to educate the patient on smoking sensations and the different types to possibly help the patient stop smoking. And we are going to provide education to the family members because a relative going through chemo is a big change in their lifestyle. So other things that we could have possibly diagnosed the patient with is tuberculosis, pneumonia, bronchitis, cardiovascular diseases, and gastrointestinal. We went ahead and did diagnose the patient with lung cancer based off the CT scan and the bronchoscopy that we went ahead and did. Thank you.